Well, hello and welcome back to our coverage of the UN General Assembly. I'm Raj Kumar, the President and Editor in Chief of Devex, and delighted to be with all of you joining us from around the world for what has become a pretty critical moment in the global development, global health, humanitarian calendar. This was at some time a session for heads of state to talk about foreign policy. It's become a place where really key development in health and humanitarian issues get talked about, decided, and even implemented. So, really delighted to have all of you joining us. And for this session in particular, I'm delighted to introduce a couple of panelists who are working on the forefront on some of the key issues we're here to talk about at this year's UN General Assembly. Ashling Mulvaney is with us. She's the Vice President of Sustainability and Access to Healthcare at AstraZeneca. And Dr. Juliet Nabyonga-Orem is the country director for Kenya at the World Health Organization. There's a lot I want to get into on universal health coverage with them, and particularly this issue of multi-stakeholder partnerships, something that's become really highlighted during the pandemic. But first, let me just welcome them to the conversation. Really nice to be with both of you. And I really want to get Juliet into the discussion. You've had this experience working across Africa. I know you're in Kenya now, but working on strengthening health systems in, I think, 20 countries in Eastern and Southern Africa. You have a long career really focused with a lot of expertise on health system strengthening, a topic that was very niche at one point and is now, I think, a very broad theme in UHC. How do you think the pandemic has shaped our attempt to reach universal health coverage? Where do we stand in that effort to strengthen these health systems?
Uh, Thank you so much for having me. I think we look at the impact in two parts. Of course, we have lost gains, we have lost lives. And indeed, one of the things you touched on is the restrictions in movement, but also we've seen extensive disruptions in service delivery. Health facilities have been closed, health workers have been infected, disruptions in supply chain systems. So service access to services has been impacted from two fronts. From the access, the patients coming to the health facility, but also the health facilities being able to provide health services. We've seen immunization campaigns being postponed because of the reallocations, perhaps. They had to reallocate money. Countries have had to reallocate money to primarily focus on response efforts. So partly that explains the postponement of essential campaigns for immunization. But also, we've seen some positives, and I think we need to take this forward. For example, we've seen the significant role of the private sector. They've really come through in service delivery, also manufacturing, the PPEs. They were able to transform their companies to do that in a very short time, and also in kind contributions, but also funding. When you look across Africa, many countries have had funds that have been capitalized by the private sector to really support the response. And what do we take away when it comes to health systems and primary health care? I think the case has been strengthened. The nexus between health security and essential health services and universal health coverage, I think now this is very clear that without strong health systems, we cannot talk of health security, we cannot talk of universal health coverage. And I think this is what we are talking about now, because we need strong systems that can quickly isolate, that can quickly contain outbreaks, that can preserve provision of essential health services when faced with shocks.
Yeah, I remember, back, what is it, half a decade ago, 6, 7 years ago, the West African Ebola crisis. And many of us in the global health field thought that would do it. That would be the wake up call, that we're only as strong as the weakest health systems in the world. We have to invest in these systems. I'm not sure it really did it. But maybe COVID now, as I speak to global health leaders, there's a sense that maybe this pandemic, so wide reaching, affecting everyone across the world, that maybe this starts to spark the idea that it's not enough to invest in your own health system or to think in very siloed ways, but to cross cut and to think across borders. Ashley, what are some of the innovations that you think are coming out of this experience we're having with the pandemic that might lead to some new approaches to how we strengthen health systems and achieve UHC?
I think it's a really important point for consideration, Raj. And, what I want to do is acknowledge that there is a pandemic, but actually reflect that there has been a healthcare crisis before the pandemic. And particularly when we look at NCDs and what we've learned through this crisis and crisis before, and I'm sure crisis that will happen again in the future, is that health is precious. And we can all be affected by emergencies regardless of age, sex, geography, or wealth. We've seen, as Dr. Juliet has said, that by working together across government and institutions, we can make great things happen. But if we look at the NCD space, we need great things to happen there. And it's not just a one and done. If I reflect on some of the programs that we've been leading at AstraZeneca for quite a significant period of time, if we look at Healthy Heart Africa addressing hypertension, Dr. Juliet, you'll be very familiar of the need to reduce the prevalence of hypertension by 25%. The WHO has just issued their new guidelines on hypertension. But our program has really looked at the fundamental need to address the disease awareness, look at education, partner with governments, partner with NGOs to really look at, facilitate that education, that long-term sustainability approach, and also look at the access to healthcare. If we don't address the fragility of our health system, we're going to not get out of this crisis. Healthy Heart Africa, it's been in situ for over 6 years. We're now in 7 African countries. We're in Kenya, where Dr. Juliet is today. We're also in Uganda, which I know you've spent a significant period of time, alongside Ethiopia, Tanzania, Ghana. We're also looking to expand into French-speaking Africa. We've screened over 20 million people for hypertension, and that has a very positive effect. We are addressing, the prevention element, the education element, but also looking at supporting the training of healthcare workers, which are over 8,000, taking those learnings from grassroots and then applying that to innovation is actually going to help secure a more positive impact for the healthcare system pre and post any crisis that comes, Raj.
You're right. And if you think about even at the beginning of the COVID crisis, so many of the tests that were conducted were using machines that had been placed and purchased for HIV testing, right? And other kinds of health systems and programs that were based on individual disease silos were, used for other purposes because we were in a pandemic moment. And I think it shows you that there's an opportunity here to think about the whole system and to use it to address many other issues as they may come up. And that it's probably not right to simply organize all of our efforts along these silos as we traditionally do. Juliet, what are your thoughts here? You talk about primary health, you talked about health systems. When you think of some of these disease areas like hypertension, what are the ones that are high on your agenda where you think we may have had a big setback and we ought to refocus our attention?
Of course, hypertension and the big four, I would say, of course, cancer. We have diabetes. We've had big setbacks on this. First of all, we are coming from a lower platform that actually access wasn't that good when we come to these 4 diseases, partly because of the way the systems are configured, but also the way the essential health services are designed. We had to do a lot of work to get these into the routine service delivery, to get them into the essential healthcare packages. And why were we in that space? Because of our information systems. We didn't have robust data to really appreciate the magnitude of the burden. And once we get on top of the issue of data, then we look at the training, the skills of health workers, the capacity of the system. It's easier to get these services at the higher levels of the health system. But we know majority of the people seek care at the lower levels, where we really need to build the capacity for the system to provide these services. And of course, build awareness of our people, to know when to seek care, to comply with instructions, and to really keep routine checks as discipline, not as something you're forced to do, but as part of discipline, something that is a health issue, because they have a lot to play on their side. Primarily health is in your hands. Make the right decisions at the right time.
And if you think about this from a patient perspective, it isn't just about going in to deal with one issue or another. You want to maintain your overall health. And we're getting so used to this issue of waves. So I wonder what you both think about this. I've talked to other global health experts who feel we've had obviously multiple waves of COVID, but we should expect waves of significant NCD diagnosis because so many people have not been able to go in for treatment, or supply chains have been disrupted. They haven't been diagnosed. And so we may see a much larger burden from many of the disease areas you just described. Is that how you're seeing the picture develop?
I would say yes. because, of course, one, the disruptions, they haven't been coming to seek care. Yeah, but also even the health facilities, when you look at what has happened to health facilities in Africa, some have closed, some have been repurposed to focus on COVID. And of course, we have lost health workers, which creates a strain on the few who are remaining. And of course, the disruptions in supply chain systems, it takes time to recover. And now we are struggling to roll out the vaccine, which is also now being managed within the same health system. So, of course, the fears, people fear to come to health facilities, that also keeps them away. So many are held back. And as we open up, of course, we're going to see a bigger burden. We are going to see more people. I think this is something we really need to plan for.
And let's not forget the tens of millions, some estimates are over 100 million of people pushed back into extreme poverty. And of course, poverty and poor health outcomes are very much correlated. You may not have the money to get the transport to get to a health clinic and to get that diagnosis. So certainly that will affect this picture too. How are you seeing it, Ashling?
So just to really build on some of Dr. Juliet's comments, we're seeing the current state. There is a risk or a likelihood more is going to come. But regardless of what happens, what we do know is that early action on prevention, the planning, education, and awareness is actually going to be really crucial and super important. If we look at it today, we need to do it now for the health of people, but we also need to do it for future generations. We need to look at what lessons we can take and what learning we have to be proactive rather than reactive. We've done a lot of work at AstraZeneca on prevention in our Young Health program, which is a focus on preventing on NCDs, and that's in partnership with UNICEF and Plan International. But actually what we've done within that has reached over 5 million youth and educated over 100,000 peer educators. What we've also seen, though, and particularly with the crisis, is that we can take many learnings together and work we have done with the London School of Economics and the World Economic Forum, which is looking at a partnership for health, sustainability, and resilience, looking at that health system strengthening, is really going to be crucial to take those learnings and look what we can put into a more proactive stage. Dr. Juliet has highlighted some of the reticence of people to engage back in health facilities, even if they are available to access. So what can we do from a technological perspective and an innovation perspective to actually bring health to the patient? What is it that we can do to leverage the latest digital innovations which are going to enable that to happen? So actually there isn't that 2-hour travel, or there isn't the queues at the health centres, or you don't need so many healthcare workers. They can actually be more face-to-face from a digital perspective. Also looking at the medical expertise we know is there in middle-income and low-middle-income countries, and there is that strong desire to offer the highest standards of care possible. And companies like AstraZeneca can really help facilitate the sharing of best practice and also innovating those patient outcomes.
Yeah, you're absolutely right that we don't need to treat this next phase of health system strengthening the way we treated the last ones. There are new digital tools, there are new approaches, and hopefully all of you watching this have taken this away. There are lessons from this pandemic. It's maybe a very thin silver lining in such a tragic scenario as a global pandemic, but we've learned some things, and hopefully the world has woken up a bit. And I just want to say a big thank you to the two of you, and your organization's obviously been at the forefront of this, and I really appreciate you taking the time to be with us here at Devex as we cover a pretty critical event, the 76th UN General Assembly. Thank you, Dr. Juliet Nabyonga from the WHO in Kenya, Ashling Mulvaney from AstraZeneca. Really appreciate both of you being here.
Thank you
Thank you so much.
Thank you, Dr. Juliet.
Thank you, Ashling.